Let me get myself situated here, because what I want to mention first off is actually on the second page. It seems like there's a lot of new studies coming out here the last couple of weeks. I don't know if we got bogged down because of COVID or what it was, but I'm coming across a lot of new research. Some of the statistics are the same. You know, every 11 seconds an older person is being treated in the ER for a fall-related injury. Every 11 seconds, right? When I give my lectures, I usually use a bell at the beginning in my introduction for about the first 30, 45 seconds of class, and this bell is just ringing in the background. It's going off every 11 seconds. You should see the looks on people's faces when I tell them and explain what that bell is, you know, and how often that's occurring. So today, I thought we would talk about stairs, okay? And this is important because this is a topic that we haven't covered. And the more I got into it, the more I realized, and the more research I found over people, actually these scientists and researchers, discussing a lack of research and even checklists for indoor-outdoor stairs, right? We have checklists for everything: our homes, our work, our place of business. If we go somewhere, we have checklists that are going to tell us what to look for, what to remove, so we can reduce our risk of falling. What we don't have, and it's acknowledged here in the research, is that any checklist or any significant data talking about falls and stairs. And the reason I bring this up is because it's been in the news lately, right? We had Ivana Trump, who fell down her stairs, and unfortunately, the coroner, his report revealed that it was blunt force trauma, all right? And so I started thinking, my gosh, I don't think I've covered anything about stairs, and so that's why we're digging into this, and this is interesting, guys. So falls among older adults are considered a major public health concern. Falls can lead to a loss of autonomy, greater isolation and depression, we've talked about that, reduce mobility, and increase morbidity and mortality. We also have talked about that. You guys, you get a significant fall. Dr. Kahn has mentioned his patients, what he sees in his practice. If you have a significant fall, they're usually gone in 3 to 6 months, right? It's pretty significant. And this is an interesting statistic. In Canada, the direct and indirect costs of falls among older adults are estimated at over $3 billion annually. Let's compare that to the United States. In Canada, think about this. Unintended falls are attributed for $3 billion annually. In the United States, it's $50 billion, okay? That's pretty significant. Look at the difference there, right? Of course, the population is different. I get that. But think about all the ice up there. You know what I'm saying? And it's still just $3 billion. That's pretty impressive. Although causes of falls are considered multi-factorial, it's well established that environmental hazards like stairs, right, or clothing in the walk path, are implicated in as many as 1/3 of falls among older adults. Research on falls indicate that 2 areas in the home are particularly hazardous for falls: indoor or outdoor stairs and steps, and bathrooms. Majority of falls happen in the home, in the bathroom. If you have stairs in your home, you have to be really careful, because that's another place of interest they've identified. An estimated 24 million patients were treated in the emergency department, emergency room, for stair-related injuries during a 23-year study. Over 1 million patients annually are treated in the ER for fall-related injuries due to stairs. Wow. Stairs are a common source of injury among individuals in all ages. This study concluded that it's a common source of injury among individuals of all ages, and frequently the rate of related injuries on stairs are increasing. And we know that because we have seniors, people that turn 65, 10,000 people turn 65 every day, right? So about 12,000 deaths are attributed to stairs annually. All right, these are 20 statistics. By 2030, there will be 7 fall-related deaths per hour if trends continue. All right, 7 deaths due to stairs per hour if this trend continues. So, guys, what we want to do is just be conscious about your steps, right? Especially if you're going through a mall and you have the escalators. You just want to be really conscious about your steps and about how you move about the stairs, right? Things we've taken for granted our entire lives. We just move freely, we walk and step as we age. And it's not your fault, right? As we age, the synapses in the brain get further apart. And what happens is we lose our agility. So we just need to pay a little more attention to what we're doing, all right? Make a conscious effort.